Welcome to the YouTube channel Dr. Mai, sharing medical knowledge. Today, we will explore an essential topic that significantly impacts our health: fat-soluble vitamins. These vital micronutrients cannot be synthesized by the body or produced in insufficient amounts. Therefore, we must obtain them through our diet. This article delves into the biochemistry, transport, and functions of fat-soluble vitamins, their deficiency syndromes, and potential toxicities. Don't forget to subscribe to the channel, like, and comment below the video to support the channel's development and suggest future topics. Let's begin. Fundamentals of fat-soluble vitamins. Fat-soluble vitamins include vitamins A, D, E, and K. Unlike water-soluble vitamins, which dissolve in water and are excreted rapidly from the body, fat-soluble vitamins are absorbed along with dietary fats and are stored in the liver and adipose tissue. This storage capability means they can remain in the body for extended periods, but it also means that excessive intake can lead to toxicity. Sources of fat-soluble vitamins. Vitamin A. Vitamin A is essential for vision, immune function, and cellular growth. It exists in two primary forms: preformed vitamin A, retinol and its derivatives, and provitamin A, carotenoids such as beta-carotene. Sources. Animal sources: liver, egg yolk, milk, cheese, and butter. Plant sources: carrots, spinach, kale, sweet potatoes, and other colorful fruits and vegetables rich in beta-carotene. Vitamin D. Vitamin D is crucial for calcium homeostasis and bone health. It exists in two main forms: vitamin D2 and vitamin D3. While vitamin D2 is obtained from plant sources and fortified foods, vitamin D3 is synthesized in the skin upon exposure to sunlight. Sources. Animal sources: fatty fish, salmon, mackerel, beef liver, cheese, and egg yolk. Other sources. Fortified foods like milk and cereals, and exposure to sunlight. Vitamin E. Vitamin E, primarily known for its antioxidant properties, protects cells from oxidative stress and supports immune function. It exists in 8 chemical forms, with alpha-tocopherol being the most biologically active form. Sources. Vegetable oils: sunflower, safflower, and wheat germ oil, nuts, seeds, and green leafy vegetables. Vitamin K. Vitamin K is essential for blood clotting and bone metabolism. It has two primary forms: vitamin K1, phylloquinone, and vitamin K2, menaquinone. Sources. Vitamin K1, green leafy vegetables such as spinach, kale, and broccoli. Vitamin K2, produced by gut bacteria and found in fermented foods and animal products like cheese and egg yolk. Absorption and transport. Fat-soluble vitamins are absorbed in the small intestine along with dietary fats. This process requires bile acids, which emulsify fats and facilitate the formation of micelles. The vitamins are then incorporated into chylomicrons, which are lipoprotein particles that transport them through the lymphatic system into the bloodstream. Key steps in absorption and transport. 1. Emulsification. Bile acids produced by the liver emulsify dietary fats and fat-soluble vitamins. 2. Micelle formation. Emulsified fats and vitamins form micelles, which are small, soluble particles. 3. Absorption. Micelles are absorbed by enterocytes in the small intestine. 4. Transport. Inside the enterocytes, the vitamins are packaged into chylomicrons and released into the lymphatic system, eventually entering the bloodstream. Storage and utilization. Once in circulation, fat-soluble vitamins are stored in the liver and adipose tissue, making them available for future use. This storage capacity is why deficiencies take longer to develop but can lead to toxicity if consumed in excessive amounts over time. Functions of fat-soluble vitamins. Vitamin A. Vitamin A plays a critical role in vision, particularly in low-light conditions. It is a precursor to rhodopsin, a pigment in the retina that enables night vision. Additionally, it supports immune function, cellular growth, and differentiation. Vision. Retinol, a form of vitamin A, combines with opsin to form rhodopsin, crucial for night vision. Immune function. Stimulates the production and activity of white blood cells. Cell growth. Retinoic acid, a derivative of vitamin A, acts as a hormone-like growth factor for epithelial cells and other cell types. Vitamin D. Vitamin D is essential for calcium and phosphate metabolism, influencing bone health, immune function, and inflammation. Bone health. Promotes calcium absorption in the gut and maintains adequate serum calcium and phosphate levels to enable normal bone mineralization. Immune function. Modulates the innate and adaptive immune responses. Hormone regulation. Acts as a hormone influencing the expression of genes that regulate cell proliferation and apoptosis. Vitamin E. Vitamin E's primary role is as an antioxidant, protecting cell membranes from oxidative damage. It also supports immune function and skin health. Antioxidant. Neutralizes free radicals, preventing lipid peroxidation and protecting cell membranes. Immune function. Enhances immune response and protects against oxidative damage. Skin health. Protects skin cells from UV damage and pollution. Vitamin K. Vitamin K is vital for blood clotting and bone metabolism. Blood clotting. Essential for synthesizing proteins required for blood coagulation, including prothrombin. Bone health. Modifies osteocalcin, a protein involved in bone formation, enabling it to bind calcium. Deficiency syndromes. Vitamin A deficiency. Vitamin A deficiency can lead to various health problems, most notably night blindness and an increased risk of infection. Severe deficiency can cause xerophthalmia, a condition characterized by dryness of the conjunctiva and cornea, leading to blindness. Vitamin D deficiency. Vitamin D deficiency is associated with rickets in children, characterized by bone deformities, and osteomalacia in adults, leading to bone pain and muscle weakness. It has also been linked to an increased risk of cardiovascular disease, autoimmune diseases, and certain cancers. Vitamin E deficiency. Vitamin E deficiency is rare but can occur in individuals with fat malabsorption disorders. Symptoms include neuropathy, muscle weakness, and retinopathy. Chronic deficiency can lead to neurological problems due to oxidative damage. Vitamin K deficiency. Vitamin K deficiency is uncommon but can lead to bleeding disorders due to impaired blood clotting. It is particularly dangerous in newborns and can result in hemorrhagic disease of the newborn, a severe bleeding disorder. Toxicity. Vitamin A toxicity. Excessive intake of vitamin A, usually from supplements, can lead to hypervitaminosis. A symptoms include nausea, headache, dizziness, and in severe cases, liver damage and intracranial pressure, which can be life-threatening. Vitamin D toxicity. Vitamin D toxicity, or hypervitaminosis D, can occur with excessive supplementation and leads to hypercalcemia. Symptoms include nausea, vomiting, weakness, and kidney stones. Vitamin E toxicity. Excessive vitamin E intake, primarily from supplements, can interfere with blood clotting and increase the risk of bleeding, particularly in individuals on anticoagulant therapy. Vitamin K toxicity. Vitamin K toxicity is rare and usually results from excessive supplementation. It can cause hemolytic anemia and jaundice in infants and is generally not a concern in adults. Testing and diagnosis. Vitamin A testing. Serum retinol levels are used to assess vitamin A status. Levels below 0, 70 micromole, L indicate deficiency, while levels above 3, 5 micromole, L suggest toxicity. Vitamin D testing. The most reliable indicator of vitamin D status is the serum level of 25-hydroxyvitamin D. Levels below 20 nanograms per milliliter indicate deficiency, while levels above 100 nanograms per milliliter suggest toxicity. Vitamin D testing. The most reliable indicator of vitamin D status is the serum level of 25-hydroxyvitamin D. Levels below 20 nanograms per milliliter indicate deficiency, while levels above 100 nanograms per milliliter suggest toxicity. Vitamin K testing. Vitamin K status is generally assessed indirectly through prothrombin time. Prolonged PT suggests deficiency, and correction with vitamin K administration confirms the diagnosis. Clinical significance. Managing fat-soluble vitamin deficiencies and toxicities requires a multidisciplinary approach involving physicians, dietitians, pharmacists, and patients. Physicians should recognize risk factors and symptoms of deficiencies and toxicities, order appropriate tests, and provide treatment. Dietitians play a critical role in preventing deficiencies through dietary counseling and monitoring. Pharmacists must ensure that patients and healthcare providers are aware of potential drug interactions that can affect vitamin levels. Patients should be educated on the importance of a balanced diet and the risks associated with excessive supplementation. Fat-soluble vitamins play indispensable roles in maintaining health, from vision and bone health to immune function and blood clotting. While they are essential, balance is key, as both deficiencies and excesses can lead to significant health issues. Understanding their sources, functions, and potential risks can help us make informed choices about our diet and supplementation. Don't forget to subscribe to the channel, like, and comment below the video to support the channel's development and suggest future topics. Thank you for joining us today on Dr. Mai, sharing medical knowledge, and we hope this comprehensive guide has provided valuable insights into the world of fat-soluble vitamins.